My name's Kerry Storey. I am the My Family, My Rights Development Officer for Scottish families affected by alcohol and drugs. I'm going to pass, I have been the My Family, My Rights Development Officer since November 2022. I'm going to pass over to my colleague Marianna just to introduce the roots of My Family, My Rights, and we'll discuss further after she's spoken. There you go.
Hi everyone, it's great to be here in Dundee with you all today. My name is Marianna Marquardt. I'm the Policy and Research Assistant at Scottish Families. And like Kerry mentioned, I'll be giving a bit of context around My Family, My Rights before I pass it back to Kerry so she can go into a bit more depth around the course and self-advocacy service we'll be talking about. So I'll start by going back to the roots of My Family, My Rights to a document called Rights, Respect and Recovery, which is the drug and alcohol strategy that most of you will have either heard of or be well familiar with through the work that you do. But just to re-summarize, it contains that human rights-based approach to improving drug and alcohol treatment and tackling drug and alcohol harm in Scotland. And that human rights-based approach is about empowering people, rights holders, to know and to claim their rights in treatment settings, increasing the ability of services as duty bearers to uphold or fulfill people's human rights. And it's also about creating a solid system of accountability so that people can seek remedy when their human rights are breached in those settings. Rights, Respect and Recovery also identifies a need for whole family and family inclusive practice, and this is mostly specified within the outcome that children and families affected by drug and alcohol use will be safe, healthy, included, and supported. And so these two aspects of Rights, Respect and Recovery are what are quite core to My Family, My Rights as a program. Referring back to that commitment around children and families I just mentioned, there are a few commitments within Rights, Respect and Recovery that the Scottish Government outlines towards achieving that outcome. One of these is families' access to support in their own right as families impacted, as well as inclusion in their loved ones' treatment and support when it's deemed appropriate. Another is families' access to services provided through a whole family approach, and that whole family approach refers to both adult family members in the family as well as children. The strategy also mentions families' involvement in the service, the planning, delivery, and development of services, drug and alcohol services across Scotland. And more generally, across Rights, Respect and Recovery, human rights are brought up time and time again. And it's important to mention that in these settings, family members also have human rights within themselves, rather than just advocating for the human rights of their loved ones who are seeking treatment or support from services. But considering that all of this is written within Scottish Government policy, when we look at the experiences of families, we still see barriers to families accessing support in their own right for a variety of reasons. We still see families not being included within decision-making, even when the decisions being made without them still directly impact them physically, mentally, and financially. Family involvement is still seen as a sort of box-ticking exercise rather than something that's truly meaningful for treatment and for recovery as well. And we still see human rights being breached when it comes to family members, with ways of holding services to account either being inaccessible for family members or resulting in family members being passed from pillar to post. And so the origins of My Family, My Rights come from wanting to empower family members to use what is already written in policy to either receive better practice for themselves or for their loved ones, or to address poor practice that they've received in the past. So with that, I will pass it to Kerry, who will go into some more depth around the course.
Thank you. So with all that being said, Scottish Families decided way back in summer 2022 to design a rights-based self-advocacy course for families to attend and get more knowledge and feel more empowered. So they had the kind of basis of that course, but what they wanted to do was make sure that families were included with that course content. So they invited along 5 family members with lived and living experience. One of those was myself. And they got to shape and kind of define what that content would look like. So they said, we don't like this language, we don't like how this is displayed on screen. We use the human rights and advocacy skills and embed them throughout all of the topics that are covered in the course. We use useful charters and policies that are highlighted throughout the sessions. So again, these charters and policies exist everywhere, but not everyone knows where to access those and how to apply those in practice as well. When anyone kind of applies to come on the course, which is now in the 5th rollout, we do it twice a year. One of the courses is rolled out February during the mornings, and one is rolled out, we're rolling one out just now for the 5th time in September in the evenings, and that's again to make sure that everyone kind of can have access to that regardless of their lifestyle. So they get folders containing all the course materials when they apply to attend the course, and those materials are relevant to what each of those 11 weeks content have in them. And like Marianna said earlier on, the concept of the My Family, My Rights was created with the rights, respect and recovery in mind. So I'm not going to bore you by going into depth here, but these are the 11 weeks of the course content as it stands just now. So the first 3 weeks, week 1 to 3, are more kind of generalised about how to build on your self-esteem, tools that you can use to be more empowered, and understanding with your loved one as well, using that cycle of change when it might be most beneficial for you to advocate for them. And weeks 4 to 10 are really get right into in depth with these kind of topics. So we cover the human rights in week 4 and talk about exactly what all those human rights are. And again, we kind of highlight which ones are more often breached in relation to addiction. But again, they could all be breached, but there are ones that are more kind of relevant. We have guest speakers on some of the weeks as well. So as we're rolling it out just now at the moment, we're on week 7. We have a guest speaker. We have Kathleen Taylor from the Mental Welfare Commission attends on week 8 for safeguarding vulnerable adults with the families really find useful. And week 10 this time around we have Shabana Hussein from the Carers Coalition attends week 10 to tell people more about their carers' rights and especially their unpaid carers' rights. I am going to try my best not to go too in depth with these, but I will put my contact details at the end, so if anyone wants to know more about that, you can get in touch. Marianna, I'm going to pass back to you.
That's great. So just to go to talk a bit about the impact of the My Family, My Rights course. We always want the course to be evolving and improving, and so on an ongoing basis, we evaluate how family members feel about the course and the impact that the course has had on receiving better treatment and practice within services. And we do this through course questionnaires and interviews. And so I want to give a bit of a crash course to our evaluation process and some of the findings that we've found through that, as well as through our measuring impact survey that we've given out quite recently. So starting off with the questionnaires, these are the 6 outcomes that have been set for the My Family, My Rights course. You can take a look at them above here, and these outcomes form the basis of the questionnaires that we give out to family members. So we've developed 2 sets of questionnaires, before questionnaire to understand where family members' grasp of advocacy is at before the course, and an after questionnaire to understand how that's changed throughout the course. And within each of these outcomes, we've set indicators which are there to measure the progress that the course is making towards achieving those outcomes. It's a sort of theory of change model. I won't get behind the theory behind theory of change model, but that's the rationale behind that. And the indicators for each of these outcomes form the questions within the questionnaires, or rather the statements that family members respond to on a basis of strongly disagree to strongly agree. And so for the next few slides, I'll go over those indicators and families' responses to that and the change that's happened over time. So for example, for one of the indicators, I understand my rights and how to apply them. Before the course, 80% of family members either disagreed or felt neutral towards the statement, whereas after the course, 90% of family members agreed or strongly agreed with that indicator. I won't go through all of the indicators just due to time, but just to point out some key changes that we've seen through the course. If it's a bit difficult to see some of the statistics within the pie charts, I've tried to sort of color code it, so the more green you see, the better. One thing I did want to point out in terms of the key changes is when we look at the statement, I can identify areas of poor practice my loved one or I have experienced. You can see that before the course, 70% of family members agreed or strongly agreed with this statement, meaning that it was quite easy for them to see that they weren't experiencing the treatment that they needed to receive within services. This changed to 100% of family members after they completed the course, which is a positive change to see. But when you compare that to the use of knowledge or guidance or legislation when advocating for themselves or their family members, 90% of family members disagreed or felt neutral towards this. And this changed to 90% of family members agreeing or strongly agreeing after the course. And so there's that discrepancy between people know that they're not receiving the proper support and treatment within services as family members, but you compare that to actually using policy and knowledge and guidance in advocating for yourself and trying to achieve more tangible change within that. So I just thought that was quite an interesting juxtaposition to show. And again, we have some indicators around confidence in attending meetings, writing emails, and channeling emotions, which can be quite effective for achieving more positive outcomes within services. We also conduct some interviews just to get some feedback around the course, just around general reflections, specific sessions, things like that. And so I just want to give you a few moments to look at some of the feedback rather than me just reading out what's on the screen here. Just to give you a few moments to take a look at that. So again, just some feedback around the use of having kind of physical copies of resources and then spreading that to other people for that knowledge exchange and really having that as a way of advocating for yourself within services. And then finally, I want to touch on the ripple effect that the My Family, My Rights course has had so far. So in May 2024, we sent out our Measuring Impact survey, which was sent out to all family members who have completed the course in its lifetime so far. And so far, 100% of respondents to that shared information from the course, whether that's to support groups, family members, colleagues, sometimes even clients or neighbors. On average, that information was shared with an average of 14 people, and that number is skewed towards the higher end because we had people who were a part of support groups sharing that within their support group, which is great to see that medium as a knowledge exchange and way of spreading that information. Human rights, treatment services, and carers' rights were the most shared modules. And then there were some mixed answers around how services reacted to using knowledge and guidance within advocating for family members. So we just had some pieces of feedback here around that. But without further ado, I will pass it on to Kerry, who will go into a bit more depth around the self-advocacy service.
Thank you. So from quite an early stage, it was decided that My Family, My Rights self-advocacy service, a one-to-one service, was going to be designed alongside the course and developed. So the course had been rolled out from, like I say, we'd kind of designed that in summer 2022, and I joined in November. It was already starting to be rolled out then. So the service was being developed as soon as I came into post. And we used the course content and the family members that shared their experiences on that for a kind of guiding point of what that service was going to involve, what topics might come up quite frequently or most often, and how to kind of use information to support people with that. So that was kind of the initial template, if you will. So we kind of always had an idea of what the most common factors were going to come up alongside anything to do with addiction, which could have been like housing, mental health. There was a lot of talk about neurodivergence as well, autism, ADHD, undiagnosed a lot of the time as well. So those were good guiding points for the service and for me to know what I would expect. As you can see from the 11 weeks of the course, it covers quite a wide range of topics from within society, and those topics apply to the course. But I should say as well, the course is open to anyone at all. It's now shared on social media, the more that it's been rolled out. So that's open to anyone, but the one-to-one service as it stands, it's on a national level, and it's just myself that's running it at the moment. So I'd be a bit scared to open that to external. But we are looking at that in the future, in the near future, hopefully expanding on that to make sure we can take in external referrals as well. I guess I should just touch on as well, it's quite easy for me to say this is a self-advocacy service, but for people, what does self-advocacy look like, or what is self-advocacy? So self-advocacy is where individuals represent and speak up for themselves. This can be done with or without support for the individual, and it can be done in a paid capacity by an organisation or unpaid by someone that is close to you as well. So an example of this, of course, is the My Family, My Rights service. I can help anyone that comes through to me prepare emails, prepare to advocate for themselves or for their loved ones. Making a phone call, sometimes they can be really nervous about making phone calls. Often they kind of know what rights have been breached or what's going wrong. They just kind of need that reassurance to say, actually, I'm not going mad here, like I am right, and you've just kind of reassured that. So I can help identify what has actually been breached, whether that be human rights, whether it be policies, charters or rights as well. We apply a lot of those throughout the course as well. So just quickly to kind of recognise as well that self-advocacy is not always about the loved one that the families are supporting. They matter as well, and it is important for them to recognise that they might have to advocate for themselves. So a good example of this that we hear quite often is where they are being asked by a service to support their loved one, even though they don't feel comfortable to do so, they don't feel equipped to do so. But again, a lot of the time, especially when it comes to parents, they feel that pressure that it's kind of their duty to do so, so they take on more than they can, bite off more than they can chew, so to speak, and are kind of left to deal with the fallout of that. So I know this was mentioned earlier on, so it ties in really well, but a big part of my service and the course is designed around the FAIR model, so that's the human rights-based approach, and as was identified in the lived experience panel earlier on, it's a really good way for families and for myself, if I identify that there's a complaint to be made, to take that kind of emotion and that personal kind of experiences away from it. And that's not to say it doesn't matter, but services don't tend to respond well to that. You need to know the facts of the situation. So again, it's facts, and analyse what's went wrong, identify who's responsible and who's accountable for that, and then your review process. So what you want to see as a result of that complaint or that feedback. So I just kind of want to touch on as well, so whilst I'm saying that I recognise that there was a lot of topics that were quite obvious to me were going to come up, especially when it comes to rights breaches, one that maybe naively took me by surprise was bereavement. Now, I expected to encounter bereavement, by all means, I definitely did, and I expected that to crop up quite a bit, but especially in the last 6 months, my referrals in my one-to-one service have been, majority have been bereaved mothers specifically, of very young adults that have been filled by services. So I think that's part of the development part of my role as well, is identifying that this is something that's cropping up. How do we address that? So anyone challenging their rights, I fully would support that. I'm all for advocating for that. I think I wanted to highlight the bereavement, especially in relation to the high number of drug deaths that we have, and to identify that it's really more of a struggle for someone to challenge their rights or their loved ones' rights that have been breached when they're also going through the process of being bereaved or grieving. Because whilst I would support people challenging their rights always, we do that in the hope that they will get some positive outcomes for their loved ones. In this situation, there actually is no positive outcome. And sadly, those families are often, even in their grief, challenging on behalf of other people to stop that from happening. So I really just wanted to highlight that and kind of say that, especially with complaints procedures, I should highlight as well, they often come with time frames. So they'll be 6 to 12 months often. So whether that's a complaint about Police Scotland, NHS, social work, they often have a time frame. So they will have like what they call the extenuating circumstances, I think. And a lot of the times, if that's verbalised to a family member, they're not told that grief would be part of that extenuating circumstances. So if someone comes through to me for support, I do identify that and say, put your complaint in anyway. But I think more often than not, the families that I'm supporting just now are challenging the systems that have failed their loved ones, whether that be social work, they've been put in terrible accommodation, they have been discriminated and stigmatised, unsafe discharges from hospital settings as well, and healthcare settings is a really, really big one that I see as well. So I know that's quite dark and depressing, but I do want to highlight as well some of the positive outcomes for my family, my rights participants that have been in the course, but also the one-to-one clients that I support at this time. So human rights, of course, we want to identify those. They're the most serious of breaches. But what I kind of try and tell families as well, that it doesn't always have to be on that level. It doesn't have to be that human rights have been breached. It doesn't have to be that policies have. Often, sometimes organisations are using terms like person-centred. We will welcome you with a friendly approach. So I often actually have started directing families to go onto the organisation's websites and look in those about us. How can we help? What you can expect sections, and use that language used in there to challenge them on it. And I've seen really good outcomes for people having their individual needs met by challenging them, especially when it comes to person-centred care. And I've had examples as well of people just asking for extended stays in healthcare settings, if it's someone waiting to get into housing, for example, and they've challenged reports that they found. I've kind of went and found a report that's maybe from a year or two before and highlighted that. So you can really, using that FAIR model, it doesn't just have to be human rights that you're using that in tow with. We use it with everything. So I know that Marianna has shared some feedback from the course directly earlier on, but I really wanted to share this feedback. It's easy for me to stand here and be biased and say, oh, this is all great, but I wanted you to see what the families that have actually had individual support as well as on the course have had to say about the difference that knowing their rights, feeling more empowered and actually feeling heard has made for them. And it just, I constantly hear it all the time. It's the compassion that's missing from the services. Sometimes, I always say, they're not asking for the moon on the stick, they're asking for what they're entitled to, and they're asking for their human rights, which, as we say on the course, is not, it's not gold standard, it's what everyone should expect. So I will, if you hear, my email is there, so if anyone has any further queries, it's quite hard in this short space of time to cover everything about the course. I know I don't go too in depth about it, but that's my email there, so if anyone wants to contact or is interested in enrolling on the course in February, then please do get in touch. And I don't know if we've got time to it. If anyone's got any questions.
Yep, thanks very much, Kerry and Marianne, for that really powerful and emotive presentation. I think you've given us a lot of food for thought.